AI models are often trained on datasets that don't fully represent the diversity of the human population. This is a significant issue because biased or incomplete datasets lead to AI systems that mirror these same biases in their performance. Let's explore 5 examples of problematic datasets currently in use and the potential risks they pose to individuals. Example 1. Psychology. In 2010, Henrik and colleagues introduced the term weird. They noted that most participants in psychology studies were students, predominantly from Western, educated, industrialized, rich, and democratic societies. Their findings revealed that people from weird societies are among the least representative populations for generalizing human behavior. This is concerning as many of the key findings in psychology, motivation, and behavior are based on such unrepresentative samples. Example 2. Dermatology. AI models in dermatology can classify skin lesions with high accuracy, but mainly for lighter skin tones. When tested on images of darker skin, the diagnostic accuracy drops significantly. This is because many skin lesion datasets used to train AI models for skin cancer diagnosis contain mostly images from individuals with lighter skin. In 2022, Wen and colleagues analyzed such datasets and found that out of 106,950 images, only 2,236 included information about skin type. And of these, just 11 images were of darker skin types, Fitzpatrick's type 5 and 6. This is alarming because skin cancer prevalence, presentation, and types differ in individuals with darker skin. If AI fails to detect these, it can lead to unequal and potentially harmful treatment. Example 3. Genomics. In genomics, datasets are heavily skewed towards individuals of European ancestry. In 2009, 96% of participants in genome-wide association studies were of European ancestry. By 2016, this number had dropped to 81%. But people of African, Latin American, Hispanic, and indigenous ancestry make up less than 4% of all samples. This imbalance poses a significant problem. For example, certain metabolism-related genes differ between people of different populations. As a result, known associations between genes and drug responses based largely on genes of European ancestry may not be accurate for the entire population. Example 4. Neuroimaging. Strong biases also exist in neuroimaging datasets. AI models analyzing behavioral phenotypes in brain data often perform worse for African American individuals compared to white Americans. In 2022, Lee and colleagues found that 2 large brain image databases, commonly used to train AI models in neuroimaging, contained predominantly images of white Americans. Consequently, these models struggled to accurately analyze brain data of African Americans. However, when the models were trained with an equal representation of African Americans and white Americans, the prediction accuracy for African Americans improved significantly. Example 5. Healthcare. In a study, AI was used to assess the probability of death from pneumonia in hospitalized patients. Surprisingly, the model suggested that pneumonia patients with a history of asthma had a lower risk of dying from pneumonia compared to the general population. This counterintuitive result occurred because asthmatic patients are typically admitted directly to intensive care and receive more aggressive treatment, lowering their risk of dying from pneumonia. Without this intensive care, however, asthmatic patients would actually be at much higher risk. These examples show that many biases arise from the ethnicity or background of the individuals included in the data collection. Only by minimizing these biases can we ensure that we do not further increase the inequalities faced by already disadvantaged groups.